First of all, I apologize to stand between you and gala dinner. We will be quick. Now, there are two speakers talking on the immunization or vaccination on diabetes. The take is different because of the countries. In US, there is not much room for a physician to play around because it is very tightly controlled on one side by the CDC, that it's kind of etched in the stone that what vaccines are generally recommended, and whatever is recommended is covered by the insurance, and not giving the vaccine or recommending by physician is a liability. So it gets a lot easier because it is pretty straightforward. So how does it change with me as a diabetes specialist? There is a very small leeway that I can use over and above the vaccination recommendation in few cases. So let's quickly see why diabetes is important to consider for proper following of the vaccination is because high blood sugar impairs the immune response and infections worsen the diabetes outcomes. So they both feed on each other. So it is important to start early and stick to the evidence-based guidelines. So the life course, we have to start early with children, adolescents, adult, and special conditions like pregnancy. So pictorially, I can see that on the right side, if you see the timeline, the first part, child as a routine, that is automatically given by the pediatric age group, and that's very standard. On the left side, that routine has been expanded. You will see the standard vaccines from the birth to 18 months, 12 to 23 months, 4 to 6 years, and every year. So that pretty much stays same for type 1 or diabetic, non-diabetic people. On the right side, as the lifespan continues, after getting the children vaccination, you go into the adolescence where HPV is given very early before the girl becomes sexually active to prevent the cervical cancer. As an adult, Hep B is typically given when there is a high risk of hepatitis B. And then Tdap is standard. I'm going to go to the next slide to explain that better. So HPV starts at 9 to 12, 2 doses. Tdap, which is tetanus, diphtheria, and pertussis every 10 years. And I'm talking as an adult. Meningococcal, you have a standard routine of first booster and then high risk for the main B. And annual influenza, that is something very different from US, that practically every person is encouraged to get the influenza vaccine in that season. Diabetics, high risk, particularly have an increased risk of influenza-related deaths, so needs to be given. Pediatric to adult transition is a little dicey area where the things can fall off, and we have to be careful that the transition is smooth. Pregnancy is a special case, as Dr. Riaz has already covered, that we do the recommend influenza, Tdap in every pregnancy. With the COVID, the CDC guidance is prioritize the high-risk patient, especially diabetes. Respiratory syncytial virus for the maternal is actually a routine, and postpartum catch-up with if there is a deficient immunity for MMR or the varicella, we do the additional vaccination. As we get older, there is additionally after 50, typically we get pneumococcal for everybody, but diabetes is must. Zoster is the same. After 50, we have 2 doses to prevent zoster. Now, respiratory syncytial virus, again, single dose above 75 and increased risk, then you start little earlier. Influenza, we talk about. And that's pretty quick summary that the difference in vaccination between two countries is mainly guided by the social circumstances. And by the way, the insurance pays 100% for preventive. So usually the cost is not the issue. It is just occasionally some patients fall in the crack and we have to be more visible.
Thank you.